Today we're doing the modality of intermittent compression or biocompression. This is the machine that is used as the setup for a compression. This is our athlete, Brandon. Okay. Today we'll be working on a leg compression, but just to kind of get over a little bit more of an interview of what everything is. This is our pressure gauge here. The pressure gauge is usually utilized by finding the diastolic pressure of the athlete. You don't want to go over the diastolic pressure, as this could cause clotting or too much vasoconstriction. As normal parameters for upper extremities, it would be between 30 and 60 millimeters of, and then for lower extremities would be 40 to 80 millimeters. This is also the increase range, so we can increase the pressure a little bit if we need to. The on-off switch, and we have two ports where we can plug our sleeves in. The one port that is open allows for the pressure to come through the actual plugs and go right into the compartment. This one is covered so air can't be leaked out and won't have any disbursement of air. Alright, so the sleeves can come in multiple different sizes. It can come in ankle, full leg, full arm, or half arm. Right here we have a full leg. Okay, these are 4 compartments, so they're different compartments, and within each compartment, oxygen or air will fill in to the compartments to create a compression around the injury of area. It will fill from the distal aspect to the proximal aspect, and the same goes for this full arm sleeve, as we also have a half arm sleeve. Same thing, the pressure will be filled distal to proximal, and it'll have 4 different compartments so the athlete can have the pressure come in comfortably. Now for the actual machine, when we plug it in, there's a tube where the air gets pressurized in, one at a time, as you see here in the compartments, 1, 2, 3, 4, and it'll fill up accordingly. Once we have that, we plug this into the machine. Okay. Once it's plugged in, you lock it into place, and you leave it there. Alright, so the reason why we use this modality is for swelling, edema, and lymphatic flow. Swelling and edema will usually accumulate during the inflammatory phase, and cold and actual compression will be utilized during this phase. The compression will allow to move the edema and swelling out of the interstitial spaces or empty spaces from injury. This compression will be utilized to actually flow with the blood circulation through the body, as the compression will create from distal to proximal, as we mentioned before, and this will allow the edema and swelling to remove from that space. This will reduce the compression inside the actual injury area and help with range of motion. Lymphatic flow is also important, as lymphatic flow will allow to remove debris and plasma buildup from inflammatory phase injury. Lymphatic flow function needs to be correctly organized during the inflammatory phase, because if it is not, then it won't allow for the process of edema and swelling to move from the actual area of injury. So now we'll have our athlete lay down, and we'll be applying a full leg cuff, because the athlete had an inversion ankle sprain. We don't have a smaller size cuff, so we'll be utilizing the bigger one. So, as we're going to apply the full leg cuff, we'll actually have the athlete lift his foot. Get the athlete's foot comfortably inside the position. So we'll zip up the compartment. We could also use a sleeve underneath this to create kind of a barrier, but we don't want to create a compression sleeve, so we wouldn't use it a flexi wrap, because you don't want to create more compression than already used. Also, in combination with intermittent compression, you would use a cold modality, as this could help reduce pain and decrease swelling in that area. So a good combination during the inflammatory phase would be compression and ice. But as we are doing today, we're just going to work on compression. So now some parameters that we have to focus on would be the on-off time. Usually for the on-off time would be 30 seconds on, 30 seconds off, or a minute on, 2 minutes off. It's more preference of the athlete and the injury occurring. Today we'll be doing 30 seconds on, 30 seconds off, and we'll be doing a diastolic pressure of 60. That's a good happy medium or in between the actual pressures for the lower extremities. So once we turn it on, the pressure will inflate. We'll get a consistent pressure, and then once the pressure is reached, we'll create the on-off time. so that the athlete can be feeling the pressure from the distal aspect to the proximal aspect. And then we'll go from that position, and this treatment time will usually be about 20 to 30 minutes. It could go a little bit longer, but typically you don't want to go any longer than that. Things to do with the athlete during compression would be to make sure that the athlete is comfortable in his position. For this treatment protocol, the athlete would be most comfortable on his back. For other positions, you would always want to keep it elevated, so if it was his shoulder, you put him more in an elevated position, seated correctly. But for today, we're just going to raise this above his heart. So this will help with circulation and edema and swelling. Indications for use of this, as we mentioned, just the indications, contraindications would be cancer, bone fractures, acute pulmonary edema, also deep vein thrombosis, and congenital heart failure. So these are things that you don't want to be using while using compression, as compression will create a vasoconstriction of the arteries and vessels and capillaries around that area of injury. After the compression is done, remove the sleeve. You would have the athlete remove his foot, you would lower the elevation.
Give it a test run.
You would wait for all the air to, so you would take the athlete's leg out of the position. You would take all the air out of the bag after done, so as some air will still be sitting inside the bag. Remove all the air. Make sure the machine is off. Unplug the machine. Make sure that the appropriate setting is covered.
I saw, like, I read a little bit of your comment, I saw Sierra's.
Wrap up.
Into my locker.
Once you're done, you would make sure that there's no constriction or any discomfort after the injury is done. Make sure that he has both sensations of both sides. And then we would be getting into our actual exercises of what pertains after his injury.